Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about frostbite. Frostbite is an injury caused by freezing of the skin and the underlying tissues. A lot of times the skin will start out with a cold, prickly sensation, may get some numbness, you may get red, white, or bluish white, or even grayish yellow skin. Skin may progress to hard, waxy looking skin. It may even cause joint stiffness and muscle stiffness. And as you start to rewarm, if you have a frostbite, it can actually get blistering as you start to rewarm the tissue. So frostbite usually occurs in 3 stages. Frost nip, where you just get mild frostbite. It's just the superficial tissues and there's no real permanent damage, but it can be pretty uncomfortable. You get numbness to the area, but you can, if you warm it up, usually don't have any side effects long term. You can get superficial frostbite, which is just deeper than that, where you get a red skin that may turn white or pale. As you start to warm it back up, you get a mottled type appearance, and you notice stinging, burning, swelling, and you may even get fluid-filled blisters 12 to even up to 36 hours after rewarming the skin area. Then you get deep frostbite, which is the one that we most commonly worry about, because it affects not just the superficial layers of the skin, but it affects all layers of the skin. Skin turns white, bluish gray, and usually you'll get numbness or complete loss of sensation, pain or discomfort in the affected area. This is when the joints and the muscles stop working, and large blisters will appear from 24 to 48 hours after rewarming. And the areas, even after rewarming, may turn black and hard as the tissue dies. And so this is a pretty significant damage, pretty significant injury. So the question is, what do you need to worry about for frostbite? The idea is prolonged exposure to cold. So whether it be cold temperatures, cold fluids, ice, even cold metals can actually cause frostbite. And once you've had frostbite, you increase your chance of being able to have it again. If you're smoking, because of the effect the smoking on the extremities like the feet and the hands, where it decreases the blood flow, you increase your chance of frostbite. Alcohol, drug use, similarly will increase the frostbite. If you have any other medical conditions that decrease your ability to react to cold, like dehydration, exhaustion, diabetes, any causes of poor blood flow, like peripheral vascular disease or other circulation problems to the extremities. Raynaud syndrome will make it worse. If you're in a higher altitude or reduced oxygen situation, again, you can increase that chances. Age will also affect it. So if you're an infant, younger children, or an older individuals, that can also affect it as well. The truth is, you get pretty significant injury, significant damage. So the idea, first things first, you want to prevent it as much as possible. You see, okay, I want to try to limit time outdoors, or if you're outdoors, wearing the appropriate equipment, appropriate shoes, appropriate boots, appropriate socks, and so forth to keep things warm. Dressing in layers, which allows you to protect it and add to it to increase warmth, and it also keeps the moisture away from the hands or the feet. The recognizing when it's starting to affect it, because you can actually move into indoors or move away from the cold and get the areas warm before they become more frostbite. The truth is, if you start to notice the frost nip, you want to treat it quicker to ensure it doesn't happen. This is Dr. Brandt Gibson, and this is your Podiatry Tips, day 146. I know we're still in the middle of the summer right now, but frostbite is one of the things that you should always keep and consider as we move into the fall and the winter.